Next, we'll go to Pat Healey from the Laker. Go ahead, Pat.
Hi. This question's for Dr. Strang and Premier Rankin. The number of calls to the mental health crisis line was up 1,443 calls this March and April, the third wave, compared to the same 2-month period in the year before the pandemic. What messaging of hope that things will be okay can you give to those who are struggling with the restrictions and the impact of the third wave on them?
So I know it's tough, and we're asking for everyone to buckle down for another 3 weeks. But this is what we need to do so that we're able to get out of this sooner. It's a challenge on many people, and we recognize that it impacts some more than others. And we know people are struggling with mental health and addictions across the province. We're going to continue to provide support where we can. There's been a number of organizations that received funding over the last couple of days. We're going to continue to work with our teams to get the funding out there to support Nova Scotians. There are helplines, as you mentioned, that they can reach out to. But I will say this, we are optimistic that we will get through this together.
Go ahead, Pat, with your follow-up.
This question's for Dr. Strang. What does a more open summer look like? Can organizations plan events with reduced capacity? Can balls, football, rugby, and soccer leagues gear up for their seasons?
So I think that's part of what we're going to see more as we start to talk in more detail about the reopening plan. I think you've heard at a national level people talking about as we start to open up. The first thing is remembering that outdoor activities will be much safer than indoor activities. So things will be less restrictive if they're outdoors rather than indoors. But we're still going to have to stay in relatively small groups throughout the summer. But we are looking at how we can open up a whole range of activities, including sports, arts, and culture activities, but doing that in a way that is the required level of safety based on the virus epidemiology and the level of uptake of vaccine.